Hello, my name is Kristen and I'm a PA here at Center for Plastic and Reconstructive Surgery. Today we are treating this patient for facial rejuvenation using injectable fillers. Areas that she wanted to focus on specifically is the hollowing in her cheeks. With age, we have these fat pads that go along your zygoma bone here, and they naturally tend to fall with gravity due to age. And so a good product for that is something called Voluma. And Voluma is a type of highly cross-linked hyaluronic acid that when we place that along that zygomatic arch, it helps to rebuild the volume, and it kind of has a little thumbtack effect here. She was also expressing concern about her jawline. We get some jowling as we age, and that little thumbtacking effect can help to soften that. So that's the first product we're going to be using. Again, that's called Voluma. Next, we're going to be moving on to the areas around her mouth. Most people are concerned about their nasolabial folds here, the what's called the oral commissures, or the lines around the corners of the mouth here, as well as the marionette lines here around the chin. So the best product to address those is something called Juvederm. And Juvederm is also hyaluronic acid, however it's a different concentration, so it works much better in these areas to help to smooth those lines and create a nice even transition. And then finally, the third thing that we're going to do for her today to further improve her chin profile and that jawline is a product called Kybella. Kybella is a newer product. It contains something called deoxycholic acid. And this product actually destroys the cell membranes of the fat cells, which means that it gets rid of fat permanently. And there's a little fat pad that sits right on top of our platysmal muscle here that adds to that submental fullness or double chin that people hate. So this is a good product to help to actually permanently not only get rid of those fat cells, but help to kind of tighten the skin in this area. All right, so we're going to go ahead and get started. You can see I've already drawn some markings here. I draw a line from her nasal ala to her tragus, to the lateral canthus, or the corner of her eye here, to the corner of her mouth, making this little cross. And that's what helps me to, that's what guides me in the injection of the Voluma, because we travel right across this line here, and that will allow me to place the product right along that zygomatic arch bone where we want it to go. Okay?